this?
Yeah, it looks great.
Okay. I think earlier I was transmitting through my Canva and it doesn't, the presentation was off.
Do you think everybody's ready to begin?
Yeah, I think we should. And then you can record it and we can share it with people who were not here.
Okay, awesome. Well, good morning, everyone. Today's roundtable discussion is titled Existing Inequalities in U.S. Farm Worker Populations, COVID, Collaboration, and Policy. The panelists for this session are Jennifer Martinez from Portland State University, Timothy Herrera from University of Oregon, Lynn Steven from the University of Oregon, Valentin Sanchez from the Oregon Law Center and Linfield University, Lidia Munoz from the University of Oregon, and Deborah Saxton from California State University, Fresno. Jennifer Martinez will be our first presenter for today. And you're welcome to share whenever you're ready.
All right, so let me just share here. So buenos dias, everybody. As you heard, my name is Jennifer Martinez. My pronouns are she, her, ella. And I have the pleasure of kicking off today's roundtable. So hopefully y'all could see my screen right now and see just the title of my presentation. So what I'm going to be doing today is just briefly describing the COVID-19 farm worker study, or COFS by its initials, and really the impetus behind it, since you're going to be hearing about it throughout several of the discussants. I just wanted to give you a little bit of background. Then I'm going to cite some Oregon-specific findings to frame my contributions around today's discussion about this concept of care remittances that I'm formulating as part of my dissertation. And so I'm understanding that as a knowledge system. And I feel like that's a really important way to segue into our conversation today about community-based research. And so just to give you a brief background, the COVID-19 farm worker study initiated precisely as farm workers were labeled essential back in May of 2020. And for some brief background, during that time, the Trump administration, or Trump himself, evoked the Defense Production Act, which required meatpacking factories to remain open despite recorded outbreaks and major outbreaks compromising farm workers' health. But historically, predating the pandemic, farm workers have confronted institutional and systemic vulnerabilities. And that's really due to immigration and labor policy, right? But also the legacies of enslavement in our current food labor system. And so currently, about half of US agricultural workers are estimated to be undocumented. And with limited pathways, we could definitely see how those estimates might even be higher. And so these existing dynamics, of power also make farm workers distrustful of speaking up, right? Or fear retaliation or deportation if they do try to speak up about how they're being treated. And so this makes systemic vulnerability almost guaranteed. And so with this background, the California Institute for Rural Studies stepped in and CIRS is a organization that has been doing research throughout rural California for over 50 years. And they made a wide call to their networks, and sure enough, there was significant interest to initiate the study. And so the intent of COFS was really around bringing farm worker serving organizations together, community organizations together, along with advocates and researchers, to together capture the missing information about what farm workers were already experiencing and were about to experience throughout the pandemic, right, in the different stages. But we wanted to do this in a way that did not compromise their confidentiality, and the data would be used for systems change, right, and policy action. And so this study culminated into 3 autonomous studies, one in California, one in Oregon, and one in Washington, with tri-state collaboration supported by CIRS. And so this model for community-based research has also garnered significant attention recently. And just to give you context on data, right? There is information about farm workers, but a lot of times it fails to create an accurate count, an accurate profile of farm workers and their families. The data often fails to dehumanize them, right? There's this disjointedness in the data. And rarely do farm workers themselves or community organizations that work alongside farm workers, are they involved in all stages of the research process. So here in Oregon, we were joined by 12 community organizations, and they were involved in all aspects of the research process, from the early meetings of research design, research questions, and interpretation of the results, including our plan for policy action. And Casa of Oregon, which is a community organization here in the state that supports farm worker housing initiatives, served as our fiscal sponsor. We also had support from researchers at U of O, like Dr. Stephen, who's here today, soon to be Dr. Herrera, Dr. Perez-Baez from U of O, Ron Mize at Oregon State University, and myself and Dr. Carlos Crespo at PSU. And so our study culminated into 2 phases. The first phase, we collected 300 surveys, over the phone surveys. And in the second phase, we did 48 in-depth interviews with farm workers across the state. And currently we're working on a phase 3, but it's not focused on data collection, it's focused on data dissemination. And so we're working on getting results back to respondents through a storytelling initiative. But so now I'm going to get into the results, some specific results to situate the conversation. Soon after we launched the study, it became clear that community organizations were going to be critical, not only in the rapid response during this time, but also the recovery from everything between connecting farm workers to PPE, personal protective equipment, to resources, making testing, vaccines accessible, or even safety nets accessible. The community organizations were going to play a really big role. And one of the major findings here in our study is that the majority of farm workers lost months and weeks of income. So that meant they had trouble paying for rent, food, housing expenses, childcare, you name it. And these impacts, just briefly, they were not equal across all farm workers. They had gendered impacts. They all, 25% of our sample identified as Indigenous farm workers. So there were also different impacts across race and ethnicity, especially for Indigenous farm workers that speak Mesoamerican Indigenous languages. They faced additional service voids stemming from language and information barriers. But what our study did a really nice job capturing as well are really the translocal and the transnational impacts. Many farm workers don't only care for their families here in the US, but also their families back home. And many times this is through remittances or money transfers, but remittances are also other intangible and intangible transfers. And throughout the pandemic, in the news, the economists, they were all talking about money transfers reaching historic highs. But that wasn't the case for farm workers. They're some of the lowest wage earners, so many of them had to stop sending to their family completely because of their losses were so severe, their loss of wages were so severe. But this didn't mean farm workers didn't resort through other forms of care or other strategies to support their families. They, were exchanging information over the phone, over WhatsApp, over Facebook. They were, exchanging resources, remedios, but also this effective care, right? And at the same time, those pláticas had political judgments about how the political responses were developing in multiple nation states. And these exchanges really do predate the pandemic, but they became particularly visible in our study from the perspective of remittances. We really noticed that these mutual care strategies were activated to overcome these barriers of information access, to be able to access those institutional resources, and simply to maintain well-being, right, to survive, to maintain subsistence, not only transnationally, but also translocally. And so just really quickly, the ground had already been paved to think of remittances as a knowledge system. In the late 90s, the sociologist Peggy Levitt coined the term social remittances to capture how remittances are also the ideas, the behaviors, the identities, and the social capital that are transferred between transnational families. So I wanted to offer a framework that centers our understanding of these exchanges as information practice, but also as a knowledge system that directly relate to the provisioning or lack of provisioning by the nation states, right? And so these are some quotes I don't have time to go over, but what I really wanted to demonstrate here is that these care remittances, these exchanges are really happening at 3 levels. The first one is farm workers and their transnational families, right? But also farm workers and their translocal communities with community organizations or promotoras or other farm workers themselves, right? Here in the US, they were also exchanging these care remittances. But a third one that I want to talk about today in the next couple slides is really this care remittances that we also exchange as a community-based research network. And just, you know, I call it care remittances because often these knowledge systems are enacted to offer, once again, subsistence, mutual aid efforts, exchange of resources, again, for well-being, for quality of life, especially when the government is not responsive, you know, to the needs that the community requires. And so in this framework that you could see here on your screen, I understand information as a foundation of care remittances. And so through information channels like information brokers, which I'm referring to promotoras or community organizations, but también pláticas with family members back home or check-ins in our community-based research, I'm understanding that as the information that was necessary to be able to assess the needs, right? Without those pláticas, without that information, we wouldn't be able to assess the needs of the care that's required. And so, you know, this recognition often goes beyond the state into really the community-based own provisioning of support. And in this framework, I have feedback loops here listed, and these feedback loops can bubble up back to the state, or they can simply stay into the community, right? But these feedback loops really become political evaluations. And here I draw, the reason for that is I really draw on what Fierros, Delgado, and Bernal say about, you know, pláticas really becoming a knowledge, where knowledge is exchanged, where it's constructed and theorized. So these care remittances are really an epistemology, right? Ways of knowing, and also a system of knowing. And it's political, but it's also beyond the state. It's also a way for farm workers to resist, right? Or negotiate who gets access to these knowledge systems. And so the concept of information asymmetry is something that relates back to political science, you know, my background. A lot of times information is thought to be the building block of democracy. And the reason because of that is, you know, we need information to be able to access any type of public, you know, goods that the government might provide. We need it to signal to our governments what programs we want, but we also need information to know when to hold governments accountable. But the lack of information really inhibits these democratic systems, right? So care remittances, in my mind, was a way to conceptualize how farm workers themselves, community organizations and farm workers, and us as a collective are breaking these information imbalances. And therefore we're democratizing information and shaping realities that otherwise the nation states or local governments either do not want to recognize or don't know how. And so my final slide here, I just wanted to end with a few principles of what I'm calling co-produced research. And a lot of this is borrowed from the care politics or the moral economy literature. But to bring it back to the beginning of the discussion, you know, these care remittances help combat information asymmetry and fill these data voids, right? Because of distrust, because, you know, language inaccessibility, because the current, you know, discrimination. And as resistance, farm workers to negotiate, right? This is a form of gatekeeping. And so in here, in this knowledge infrastructure, I'm really understanding some principles as, you know, confianza. Without confianza, without trust, right? We don't, that determines who gets access to this information, right? But there's also this idea of commitment, of a compromiso within the network that we saw as this community-based research elaborated. But also this idea of reciprocity, right? Where it's exchanges within each other, a mutual exchange in various ways. And so for us, I think that's why in COPS, it was necessary to recruit scholars that either have a record of promoting farm worker rights or their epistemologies, or have lived experiences about, you know, the plight of farm workers. And of course, community organizations as well. So I'll close it out there and pass it back to Tim, and I look forward to hearing from the other panelists. Thank you so much.
Okay, I'm about to start. I'm just trying to reorganize the participants. Okay. Well, hello everyone. My name is Timothy Herrera. I'm a PhD candidate from the University of Oregon, and today I will be discussing my experience collaborating with Huerto de la Familia and the COVID-19 farm worker study in Oregon. So my research in Lane County, Oregon is with diverse indigenous communities in diaspora from Mexico and Guatemala and Latino community members, which examines how people engage with their cultural foodways through community gardening and how communal agriculture is an important aspect of care work, self-care, and familial care. My field sites for this project span 7 community garden sites located throughout the cities of Eugene and Springfield in Lane County, Oregon. These gardens are linked together through the community-based organization Huerto de la Familia, a division of the nonprofit organization Centro Latinoamericano. During 2020 and 2021, I participated in the collaborative research project known as the Oregon COVID-19 Farm Worker Study. I helped with data analysis from the phone survey that was conducted by the 12 community-based organizations that was previously mentioned. And after the survey, during the second phase, I helped carry out 4 in-depth ethnographic interviews out of the 48 that we did as a whole team. And these 4 interviews were all with Huerto de la Familia members. And these members are also from different agricultural backgrounds. Some were in forestry, some worked in nurseries, some worked in food processing. So the significance of research. My research considers how participation in community gardening can serve as a social, emotional, and health resources for families from Mesoamerican indigenous communities in diaspora and Latino communities, indeed as a nexus for alternative forms of care work. One of my research goals that framed this project was to examine how engaging in cultural foodways remains an important aspect of care work, despite the many challenges and traumas of migration, the ongoing effects of the COVID-19 global pandemic, and other structural vulnerabilities. I explored the concept of care work at community gardens and analyzed the impact of COVID-19, extreme wildfires, and climate change on the communities I collaborated with, which has resulted in stress proliferation, which is both cumulative and ongoing. So who gardens at Huerto de la Familia? I primarily worked with indigenous communities in diaspora and Latino communities in Lane County, Oregon, who rent a garden plot at one of the 7 community garden sites managed by Huerto de la Familia. This organization began in 1999 with only 6 families being served, and in 2022 has expanded to serve over 180 individuals and their families. According to the annual demographic intake survey collected by the organization, in 2021, a little over 80% of garden members report they are from Mexico, about 5% are from Guatemala, 13% were born in the United States, and about 2% migrated from another country. Languages spoken at the garden include Zapotec languages, Mixtec languages, Nahua, Spanish, and English. And at the new proposed garden site, there are communities where Mam, Quiche, and Canjobal is spoken, which are indigenous Mayan languages from Guatemala. So little did I know at the time that the year 2020 would be drastically different with the global COVID-19 pandemic. And the various forms of care work that were already happening at the garden would become invaluable as sources of care and care work throughout the procurement of food, medicine, and collective resource pooling. In response to the society-wide distress affecting everyone during the pandemic, especially indigenous communities in diaspora, I noticed amongst various gardeners that the theme of care work became prominent in the conversations we shared. In addition to the COVID-19 pandemic, in 2020 and 2021, Oregonians experienced record-breaking heat waves, extended fire seasons, and severe drought. At the peak of the Oregon wildfire season in September of 2020, parts of Lane County needed to be evacuated, other areas were on evacuation notice, and the entire Willamette Valley was filled with smoke, which turned the sky red while it rained ash for a week. The numerous wildfires impacted most people living in the Willamette Valley, people who live near the forest, and people living along the Cascade Mountain Range in a negative manner, especially marginalized communities that have been disproportionately struggling with the pandemic. Almost all the participants that I interviewed or conversed with regularly discussed how the changing circumstances has caused some sort of suffering and turmoil in various aspects of their lives. And just for an example of one of the people's testimonies that I interviewed, just remember Patti is a pseudonym and it's not her real name, but Patti is a longtime garden member, mother, and farm worker who works in blueberry and strawberry fields and does other types of field work seasonally. She expressed fear of getting infected with the virus. Patti related how she was exposed to the virus at work when 2 of her coworkers got sick from COVID-19. Fortunately, Patti did not get sick from this exposure when she got tested for the virus. Patti worries deeply about the number of people still dying from COVID-19, especially since she knows people from her hometown in Veracruz, Mexico, and that have passed away from being infected. She told me, we are still worried about when this disease is going to go away, which hopefully will be soon. So it will go away. Well, we are also worried, things being as they are, because a lot of people are still dying. In my hometown, there in Veracruz, there are some people we know who died of COVID-19. Patti's income was greatly reduced since there was very little work available during the pandemic. She lost work for most of 2020 and barely started working regularly again in the berry field at the beginning of 2021. During our interview, she told me, yes, but right now there's the pandemic that began and that lowered work a lot. There's almost not as much work right now. You see, I started working just a month ago. Hours went down a lot from this disease. It doesn't let you work much. In addition to the loss of work due to the pandemic, Patti also lost over a week of work due to the 2020 wildfires and needed to stay home to avoid the hazardous air quality. Losing work was financially stressful for Patti and her daughter and impacted her family in Veracruz, Mexico, since she was not able to send as many remittances to the family as she used to send. At the time of our interview, Patti had not utilized any financial assistance for lost work or rental relief. Patti discussed how she speaks Nawa as her first language, but she was not able to find any information about government aid, other financial help, the pandemic, vaccines, or workplace safety in Nawa. When I asked if Patti had received any information about resources and the vaccine in her primary language, she responded, no, everything's in Spanish. I speak a different language. It is called Nawa. This was a common occurrence for other indigenous farm workers as revealed in the phase 1 of the COVID farm worker study. And this is just a brief summary of some of the ways that care work was enacted at gardens. And because my research take place both before and during the COVID-19 pandemic, I demonstrate how caregiving practices forged through community gardening continue to have benefits through the pandemic by alleviating isolation through shared experiences outdoors, at safe social distance through gardening, by being able to support one another by sharing the surplus from their gardens, and by getting access to resources from the organizations such as bilingual services for pandemic relief funds, COVID testing, N95, KN95 masks, herbal remedies, and vaccine clinics. And a lot of these things that I share relate to the concept of care remittances that Jenny was describing in her presentation. So that's all I'm going to share for now. And I would like to welcome our next discussant, Dr. Lynn Stephen from the University of Oregon.
Thank you, Tim. Let's see, I have to share my screen. I just need a minute. I'm hooked up to monitor. Okay, can people see what I'm sharing?
Yes.
Okay, great. Thank you so much. I'm so excited to be here and particularly to hear from my colleagues. I want to thank them all. And we have several PhDs happening here doing new theorizing from this project, as well as all of this policy work. So I'm really pleased to be a part of this. My talk is called Diasporic Communities, Conceptualizing Indigenous Farm Workers from Mexico and Guatemala. And I'm going to add, I think, to the conversation here, which is about sort of how we're reframing from the perspective of farm workers, the way that farm workers are labeled, thought about, and sort of driving concepts from that knowledge base. At the first ever Mesoamerican Languages in Oregon conference that was organized by Jenny Valentin, who's here, and our colleague Gabriela Perez-Baez. This is a conference that drew together Indigenous staff from 6 different community-based organizations, 2 different state agencies, and several academics with an audience of about 150 people from Oregon government agencies and CBOs. And one of the things that came out of this meeting, which is an ongoing thread in our work, was discussions of how to label what I call here Indigenous farm workers or diasporic Indigenous communities. The meeting was conducted in Spanish, English, and partially in Quiché and Hmong. I was a presenter and I attended. So I was sort of starting with some lessons from this conference, but which also have come from the ongoing work that has been described that I've been a part of. The meeting was on Zoom, and an energetic debate in the chat centered on rejection of the term Latinx and the importance of highlighting the term Indigenous and the complexities of other categories such as Mesoamerica. And it also really centered how people understand academic labels versus those that Indigenous folks use to talk about themselves. The discussion highlighted the search for a pan-Indigenous term that is meaningful to all, while at the same time underlining the importance of specific localized languages and pueblos or peoples. One participant from a new organization that promotes events and spaces for Indigenous communities from Mexico and Guatemala wrote, "Indigenous peoples can become invisible when they're categorized as Latinos. We're here and we face racism." Another participant chimed in later after several people identified the people they work with as Latinx. Quote, "The main issue in Oregon is the lack of Mesoamerican staff in community-based organizations. The term used in outreach is not inclusive. Latinx is a Eurocentric term that does not apply to those of us from Mesoamerican Indigenous communities." Several presumably Latinx participants asked about what term should they be using, saying, for example, "I agree with the problems with the term Latinx, but could you please educate us on what we should use?" One of the Indigenous respondents said, "The term some of us used is based in the specific community we belong to. It would depend on the community. We use pueblos originarios, First Nations. I identify as New Sabi." Another participant chimed in, "I generally refer to myself as Indigenous, Indígena Maya, Caquichel, Quiché." It'll be good to have a general understanding from Indigenous people here about what terms are acceptable and generally understood by our communities to include instead of Latinx. The primary emphasis in the conference was on recognition of the different Indigenous languages and communities represented in the state and the importance of specificity down to communities of origin in order to facilitate accurate information and interpretation. It was noted at this conference that, as my colleague Jenny just pointed out, that the Croft study at that point had documented 26 distinct Indigenous Mesoamerican languages. That is now 29 with multiple variants. Often state and federally sponsored programs that offer information in Spanish are not accessible, as we've seen through Tim's example. What then Latinx state workers and other Anglo workers want to know is the right label for Mesoamerican Indigenous people in Oregon. Is there one term that everyone agrees on? How do we refer to Indigenous residents with respect and accuracy? And I think these questions are ongoing. I participated in the project both in terms of writing, but I also did some of the phone surveys and some of the qualitative interviews with Hmong Indigenous participants. So these open questions are clearly important to people from the different language communities represented in Oregon. And how people refer to one another as we see, is often very different than how government workers or academics speak about them. And what I'm hoping to do in collaboration with my colleagues is sort of change the language and understanding in our state and beyond. I think it's very important for us to sort of push and center the concepts that Indigenous folks are using to refer to themselves, that my colleague Valentine will further comment. I also think it's important to link these findings to using the labels of migrants and immigrants to refer to Indigenous people. I actually question those labels, particularly immigrant. Such a questioning is important because it's centered on highlighting the structures of settler colonialism that permeate the US, Mexico, and Central America historically and currently through different ways of elimination, whether that's assimilation or ignoring people or putting them under another label or literally killing them. And also heeding the call of Indigenous activists and leaders such as Valentine, who are working to lift up the importance of Indigenous languages and communities. Indigenous farm workers who cross national borders are crossing borders that were created as a part of the processes of settler colonialism, aimed at the elimination of Indigenous people through various means to claim territory for white supremacist nation states, or what we might call settler states. In my early work, I've used the concept of trans-border communities to explore how Indigenous peoples who migrate experience multiple border crossings as they move over borders of ethnicity, race, class, gender, sexuality, region, nation states, and reconstitute their identities and communities along multiple dimensions in multiple sites. By embedding the notion of trans-border communities and territories in the framework of settler colonialism, the continuity of such projects, such as inscribing racial differences that justify dispossessing people of their lands, which is still ongoing in Mesoamerica, particularly through mining and forestry, or according different rights or differential access to justice and political participation. By embedding trans-border in settler colonialism, it keeps us aware of these ongoing continuities, the historical continuity of the settler colonial imperative of dispossession, extraction, and elimination. Indigenous peoples from Guatemala and Mexico or Mesoamerica have been in movement historically for a very long time. The movement of Indigenous peoples inside of Mexico, inside of Guatemala, what we now call Mexico and Guatemala, back and forth across the southern border from Mexico, or across what is now the northern border to the US has been well documented. More recently, often linked to patterns of employment, violence, and displacement. When Indigenous peoples cross the northern US-Mexico border, they're often lumped together with other people from Mexico and Guatemala or elsewhere as undocumented or illegal immigrants. The national border of the US triggers other labels as well, as we saw, including Latino, Latinx, particularly if people settle, rendering specific Indigenous identities invisible. My proposition here is to label the movement processes of Indigenous peoples as trans-territorial or diasporic, signaling that Indigenous peoples in the continents of North, Central, and South America, known as Abya Yala, are first peoples, and their movements today continue historical movements across different Indigenous territories. Taking a lead from the Indigenous diaspora in Los Angeles project of Comunidades Indígenas en Liderazgo or Cielo, I choose to use the term Indigenous communities in diaspora. This is a deliberate rhetorical move to push our analysis to not rely on the word migrant, as that often results in the lumping together of Indigenous farm workers with non-Indigenous people, and also by using this label, it signals the historical layers of movement and interaction among Indigenous peoples of Abya Yala prior to the emergence of settler states. Discrimination against Indigenous farm workers on the part of non-Indigenous Mexicans and Guatemalans in the US, Anglos, and others who they're often classified as immigrants and migrants, is another reason for the term indigenous communities in diaspora. The COF's Oregon project has deliberately worked to sample indigenous farm workers in order to have a database for advocacy based on the very specific experiences of indigenous farm workers in Oregon who are found in specific diasporic communities. These diasporic communities are in turn connected to other locations through networks that span regional, state, and international boundaries. They're multinodal and place-based, but also sharing in information, as we heard, and knowledge through thick networks connected through social media, phone calls, computers, and different kinds of remittances. So I hope our next project that we're working on, organizing myself and my colleague Gabriela Baez, we've been in discussions with my colleagues here, is mapping Mesoamerican languages and communities in Oregon, and working with those communities to push out those identity labels and that information in a way that advantages them. Thank you very much.
Thank you so much, Lynn. Next, I would like to welcome Valentin Sanchez from the Oregon Law Center and Linfield University.
Thank you, team. Thank you, Lynn. Thank you, Jennifer. My name is Valentin Sanchez, and I'm a community educator with the Oregon Law Center's Farmworker program. And I'm also a full-time student at Linfield University pursuing a major in sociology and a minor in environmental science. Nani Valentin Sanchez, Centro de Leyes de Oregon. Just very quickly, a little bit about my background. I was born in a small remote village called San Juan Cahuillaxi that is located in the municipality of San Juan Mixtepec, Oaxaca, Mexico. And I grew up speaking my parents' native language, Tu'unsavi, Mixteco, and also speak Spanish. And I have been working with the Oregon Law Center since 2002. And part of the reason why I was hired by the Oregon Law Center was because the Oregon Law Center realized decades ago that farm worker population was becoming very diverse, and therefore we needed to have the resources and the capacity and the ability to connect with indigenous farm workers as well, to ensure that they're aware of their employment protections. And soon after I was hired, we also hired Santiago Ventura, who's now back in California. He's from San Miguel Cuevas. And we also brought on board Marcelina Martinez, who is also from San Juan Cahuillaxi and speaks Tu'unsavi. Because we realized that in order to adequately serve our diverse farm worker population, we needed to have the language ability to be able to provide information, to be able to represent them, whether it's filing an administrative complaint or filing a lawsuit in court. And the topic here is advocating for indigenous farm workers in COVID-19 and beyond. Lynn and Jennifer have talked about some of the critical exclusions of laws and how the exclusions of farm workers from critical legal protections makes them extremely vulnerable to exploitations. And that's why the Oregon Law Center has been doing, in addition to litigation, in addition to providing information, conducting outreach, we realized that it's important for us and for our client communities to do advocacy work. Farm workers are excluded from critical policies, critical rules, critical laws. And the only way that we can address those issues is by being in the decision-making table, lifting the voices of farm workers to ensure that we create laws, regulations, and policies that really reflects and addresses the needs of farm workers. And and during when the pandemic started, our farm worker director knew that the state needed to act quickly to ensure that farm workers were protected. And so our farm worker director, Nargis Shadbeh, reached out to Oregon OSHA, which is our state equivalent of federal OSHA, that enforces health and safety protections here in the state. And so she reached out to Oregon OSHA and said, we need to do something immediately. Otherwise, we're going to have thousands and thousands of farm workers who will be exposed to COVID-19. And so from the beginning of the COVID-19 pandemic, Nargis and other colleagues were really involved in advocating for workplace protections to prevent COVID-19 exposure. The other issue that we have been working on for a really long time, since 2002, has been language accessibility. One of the things that the Oregon Law Center did back in 2001, I believe, was to engage the Oregon Judicial Department to train Indigenous language speakers to become qualified interpreters. I was doing a lot of presentations to social service providers, CBOs, state agencies about the importance of providing culturally and linguistically appropriate services to farm workers. And one of the issues that was raised in almost all of our presentation was like, I'm sorry, there's nothing we can do. There's no interpreters that can help us communicate with Indigenous language speakers. So that's one of the reasons why we thought that in addition to litigate cases, we needed to also be engaged ensuring that we have qualified Indigenous language interpreters to be able to help not only our state, but also CBOs and other organizations so that they can better serve their client communities. And the last training that we conducted in collaboration with the Oregon Judicial Department was in 2019. Before the pandemic, we had more than 20 Indigenous language speakers. And for the first time, most of them were Indigenous language speakers from Guatemala. We had Quiche, Mam, Chu, and other Indigenous languages represented in that training. And also, the wildfire smoke, there were no protections for farm workers to protect themselves when they were working in wildfire smoke or when the air quality index was super high. I remember back in September 2020, we received calls from farm workers around the state calling us and saying, what protections do we have working in wildfire smoke? And while there are general clauses that protects farm workers, there were no specific regulation that require employers to provide adequate protective equipment or PPEs. That's another work that our program launched was to push for regulations that would protect farm workers when they had to work during wildfire seasons. And so currently we have a temporary rule. Oregon OSHA is currently in the process of finalizing the rules that will be in place hopefully in the upcoming months. Also, heat stress has been an issue that the Oregon Law Center has been working on for several years. On July 2021, Oregon OSHA finally adopted emergency rules after an Indigenous farm worker from Guatemala died while working on the job. And also, Oregon OSHA is currently in the process of finalizing that rule, which we hope that it will be finalized sometime in April. But for many years, the Oregon Law Center has been pushing for better workplace protection for farm workers. And another issue that we have been working on is labor camps. Here in the state of Oregon, we have more than 300 registered labor camps. And unfortunately, many of the labor camps are in substandard housing condition, inadequate insulation, broken windows. Some of the camps are located right next to an orchard, where growers have to apply pesticides. And so you have farm workers and their family members, their clothes, their cooking area that are exposed, to chemicals. Nargis Chadve, our farm worker director, is also continuing a lot of work around, how can we improve the housing standard to ensure that when there's wildfire smoke, there's heat stress, farm workers are adequately protected, and not just farm workers, but also their family members. And one of the biggest challenges that we have faced is, the lack of data available to be able to push for better workplace protections. And that's the reason why the Oregon Law Center has been engaged in many community-based participatory research before the pandemic. We work on a multi-year pesticide research study with Indigenous and non-Indigenous farm workers. Some of our colleagues also worked on another CBPR that involves sexual harassment when it comes to Indigenous female workers. And that's why we, felt that we needed to be part of the COVE's research effort, because, data is super critical. We need each state in the nation to have adequate data about not only farm workers, but also Indigenous farm workers, whether, it's Florida, Arizona. We should have that data available, but unfortunately, there's a gap. We're lucky to be living in the West Coast, where California, Oregon and Washington has been doing a tremendous job, try to, launch efforts to obtain better data when it comes to Indigenous farm workers. And also wanted to share that just a week ago, I completed my open enrollment for medical healthcare. And one of the questionnaires, the race and ethnicity questionnaire that I received, it actually had a place where I could choose who I am. It gave me the opportunity to say, it had a box. It says Indigenous, Mexican, Central American, or South American. So if you check on the box, it also says, if yes, please specify your primary racial or ethnic identity. And so I was able to put in Mixteco. And so I think, there are efforts that we all can take that are simple, that can really help us to gather data of who lives, who works, who are our neighbors, who are our workers, because that will give us the ability to really, ensure that we're providing information, resources and representation in people's, native Indigenous languages. So if we don't have that information available to us, we're not going to be able to know how to better serve our client communities. And so I hope that our state can manage to create a system that works not just for people that speak Spanish, but also for people that speak Indigenous languages. And so with this, I wanted to end with a quote that was shared in one of the interviews that we conducted. And the quote, it's a response to questions, to a question, what would you tell your city or state leaders? And the quote says that they take into account the indigenous people. We're also humans and we need more support, including assistances. We need information for our well-being and to prevent diseases, or so we can be prepared for when a disaster may come. And I think this is really important. COVID-19 has really shown us, all the work that needs to be done. We're going to continue to face more frequent, more severe wildfire, smoke, heat. And so we need to be prepared as a state, as a city, and as CBOs to better serve our client communities when they need us the most. So with that, I want to say thank you, and I appreciate the time to share my perspective here.
Thank you so much, Valentin. Next, I would like to welcome Lidia Munoz from the University of Oregon.
Okay. Hi, everybody. Thank you very much for having me here, and it's great to hear everybody else's perspective. Let me see if you can see. Okay. So my name is Lidia Munoz, and I have been doing research with H2 workers, which are a specific type of workers that come to the US under a visa, which can be like broadly divided in H2A visa and H2B. The H2A visa is generally used for farm work, and the H2B visas is used for other, they call it low qualification work, but most of the information here, how can I change this? Okay, it's going to be based on H2A, but it also includes some parts of H2B because a lot of meat plant workers come with an H2B visa. So I want to talk a little bit about the impact of the COVID-19. The first recorded case happened in Mexico on February 27th, and by March, which was like when it really gathered like national attention in Mexico, that was the same time, with the first big season of the H2 workers that starts also in March. At the moment, me and another small group of researchers that have been involved in the research of the H2 workers have like a lot of questions and also some like important concerns, because how do I change this? There we go. We had like some questions. First of all, the consulates in Mexico and all over the world, they came to a complete close. And our first question was, are we really going to be like, the visas are going to be continue to be issued or not? Also, we had a question of what would be the protective measures that will workers have? What would be the requirements for workers? Would they be asked to be tested? Was COVID-19 going to be considered an occupational risk disease, and therefore the workers will be able to be covered by employers' insurance, or was it not going to be considered an occupational risk disease? We already knew like some things that make us be really concerned about it. We knew like the housing and working conditions are most likely not going to meet the physical distance requirements. We already knew that employers do not always provide or facilitate medical services. We already knew that sometimes workers are dismissed when they get sick. So we were wondering how this was going to happen, or how will this play out within COVID. We also know that H2 workers are more isolated than other types of workers because they depend exclusively on the relationship of the workplace. So they don't have a larger support network that can help them in cases of illnesses, or in case they are sent home. I mean, if they are sent home, they're sent back to Mexico. But in the meantime, what will they do, or what kind of resources they have? Also, as it's common to other farm workers or other workers, they also lack English language skills. And there are specific vulnerabilities that they face, basically that they mostly leave the country once they are unemployed. But there's also no public policy in Mexico, so there are not monitoring tools to assess the health or the even the infection rate of workers if they were going to come back to Mexico. So these were some kind of our first questions and concerns, and we thought that this juncture would perhaps provide an opportunity to be like serve as a catalytic effect to attract attention that is like largely overdue to the program. So we engaged in several actions. One of them was we tried to circulate widely a brief summary that we tried to make available to Mexican, the Ministry of Foreign Affairs, the public health officials. And our objective was to develop like a workforce that will allow us to create. We even engaged in some like preliminary talks with app developers. We were trying to create a system to create information assistance, follow-up and tracking for the H2 workers affected by the pandemic, but also use it as an excuse to start creating some statistical information about the workers. Because as it's noted, like just our colleague Valentin said, you know, data information is critical and H2 information is not widely available. So we started this effort beginning in March, not last year, in 2020. And for 3 months, we really engaged in an intense outreach and trying to follow up with the information that was circulating. But by May, it became clear that the authorities, the Mexican authorities, would not be interested in creating public policies for the H2 population. And also we were starting to see some answers to our original questions. So once the preventive measures that we were trying to establish failed, then we switched for a moment into trying to really assess what was the impact of the COVID pandemic having on NH2 workers. So these are some reports that media reports that gathered that were like focusing on specifically on the H2 workers. And well, our first answer was that actually the H2A visas were not decreased. In fact, they were the only type of visas that the USA increased during the fiscal year 2019 and 2020. And also, if you see that there's like an H2B decrease, we also need to take this with a nuance because there was a special provision made by the Department of State so that H2B workers that were already in the US did not have to go back to Mexico, and they extended their period of stay in the United States. So a lot of H2B workers were able to stay like on longer periods of time, and therefore there was a lesser need to have new visas. So we started like trying to gather some data of how was the COVID-19 pandemic affecting specifically the H2 workers, and most of them, as I said, H2A. And besides like having the reports from workers and having calls, they will tell you what's going on with them. There was this, maybe you are familiar with it. This is the FERN project. That's the Food and Environment Reporting Network. And this was specifically made by Leah Douglas. And in her words, it was an attempt to document the toll of the COVID-19 pandemic on the US nation's food system workers. And through almost like a year and a half, she documented this. A lot of this was community reports, because as she says, the project was hamstrung by a chronic lack of data from private companies and public health departments. While a couple of meat packing companies shared sometimes testing data, the vast majority of food companies never reported any information on worker illness or death. And in general, she also states that there has been no federal agency that has stepped in to collect or publish occupational illness data for food system workers. So what she did in this project was a lot based on independent reporting and also community reportings, and she was trying to track also the impact in food systems. So what we know now that is mostly based on ethnographic data. We really do not have statistical data on how to make like wider assessment of how this has played out. We do know that preventive and treatment measures were left to the discretion of employers. What I mean is that basically employers decided what measures to take. Some of them tried, some of them didn't. It was really kind of draw of the luck. There's, as I said, a large difficulty in processing information and following up on the cases. We do know that employers of H2 workers were not required to report H2 COVID cases to DHS or DOL, which are like the agencies that grant the permits for the petitions for the H2 workers. And what we have gathered from workers' experience is a general lack of safety measures, including lack of equipment such as face shields, distancing measures, and continuous testing. We had a question if workers would be asked to be tested before entering the work sites, and most of them have shared that they did not get tested. There are also reports of workers who were forced to work despite having obvious symptoms of COVID-19. And some of those who refused to do so, or even like left the workplace to go to a hospital or a clinic seeking treatment, they were fired. COVID-19 absences were reported as abandonment of contract, which is a violation of their visa, and therefore they were reported to UCSIS, which has an immediate implication that they are supposed to leave the country, but they also have the implication of being penalized so that they will not be able to get an H2 visa again. Of course, because some of these workers are in isolated places, they face difficulty accessing testing and treatment sites. Not always, as again, it's difficult to say in numbers because we don't have statistical data, but some instances employers will provide transportation and some instances they would not. So workers had to get to the sites, treatment sites, and even testing sites in whichever means they had. Once, if they got to access to some treatment sites, most of them would go to the emergency room because that's what they could think about was the best place to go, and ended up incurring in very high cost of treatment that they had to pay out of pocket. And some workers decided to return to Mexico for treatment. And besides the structural implication of losing the job, what I've already talked about, this had an effect, on increasing the infection rate in the communities of origin. So this is like what we know from the initial reports, and I would be like also very interesting to hear from ideas of this fantastic panel of what other tools could we use to assess the impact of COVID-19 on H2 workers. Specifically because, as I said, what my experience has shown is that they are not very well connected to other community organizations or farm workers organizations or food processing worker organizations. So that makes them also difficult to have network of support in these cases. And I think what I've talked today also shows in general the need that we need to pay attention to the health in the context of a temporary program, a temporary working program in which the health responsibility is shared. What by shared I basically mean is basically not taken into full responsibility for either the country of origin, which is Mexico, and also the country of destiny, which in this case would be the US. So thank you very much. And I'm going to end here my presentation.
Thank you so much, Lydia. Next, I'd like to welcome our discussant, Deborah Sexton.
Thank you all for really powerful, exciting work and listening to you all today has renewed some of my hope in research and in emerging scholars in particular. Some of the I have so many notes, and I'll try to write you all a little note about my more deeper thoughts on each piece. But some of the questions that arose for me during your presentations as a whole were, how does theory work? These important theories of care and remittances and identity work and identity shifting to more firmly establish rights for people classified as immigrants or migrants in the US. How can theory work more closely support movement work? How do movements also fuel theory work? That was very apparent in Jenny's piece and in Lynn's piece in terms of how the language of communities and community-based organizations and indigenous peoples change the languages of academia and institutions. Often that is erased from academic writing, and I think it's great that many of you are acknowledging that in your work and also in Valentin's work too, documenting those processes of how those shifts at the policy level, at the agency level are happening, not from the benevolence of agency people, but from sustained pushes from community groups, community-based organizations. How can these knowledge and care ecosystems within research practice become more equitable or more reciprocal? In anthropology, we talk a lot about reciprocity, and I've been reflecting on it too, particularly within the COF study, that there were reciprocal exchanges between the CBOs and the communities and the community members, farm workers who participated in the COFs, in terms of those who were connected were able to access resources that maybe they probably wouldn't have had access to if they weren't part of those pre-existing networks. And it makes me think a lot about workers who are not part of those networks, like H2A workers, H2B workers, and then the thousands of other farm workers who just are not connected to community-based organizations due to geography, due to being newer arrivals, due to the limited capacities of CBOs to reach into more hinterlands areas. In the Central Valley, you know, a lot of resources are hyper-centralized in the big cities like Fresno, Bakersfield, Visalia, Merced. And so folks that live in what I call the hinterlands, which is just this weird English word to refer to like everything outside of the city, aren't as connected. But the pandemic has sort of forced some organizations to reach further, to be more sustained in their connections and collaborations, to decentralize a little bit. And so I think that's going to be another important part of this work, is how do we also decentralize movement work and expand the reach even with limited capacities, and how can we leverage this moment of pandemic and crisis to further entrench funding and acknowledgement and not just make it go away, because right now there's also a lot of effort by corporations to say everything's okay now, we don't need to do this. The discursive shift from pandemic to endemic is encouraging a lot of grower shipper organizations to push to relax a lot of the protective policies that are literally just barely keeping people alive, like masks, social distancing. And this is happening too in our own institutions of employment. As my university relaxed their mask mandate and then very abruptly said, oh, well, individual faculty have rights to say that students should wear masks in class. So there's these tensions that are going to be continually, we are at risk. We're at this point where farm workers and food workers and indigenous peoples and immigrants' rights have constantly been in this perpetual state of erosion and limbo between labor and immigration policy. But I think there's an opportunity too to mobilize around the broader erosion of labor rights across institutions, across professions, to make sure that we're all protected and safe. And in my book, The Devil's Fruit, I talk about this as cross-occupational or trans-occupational solidarities. And that's something that happened too in the COFs and in all of your work in terms of how are you leveraging data to support movements and to support public health, legal rights for Indigenous and immigrant people. So how can this knowledge care system, care ecosystem be more equitable? How can academics be more reciprocal and more accountable? And how do we use our own gifts of language, community, and position to expand this kind of gift economy that I like to think about the things we're doing as a gift economy, but how can we keep pushing it to be more equitable and less transactional in our work? Let me start with Jenny now, shifting into more individual comments. I really appreciate the theoretical work you're doing around remittances as care work and knowledge systems. And I appreciated, I think that was your parents in the first picture, or was that, yes, I knew it. So there's also some intergenerational knowledge exchanges happening that are informing your theoretical work, which is really beautiful. As you were talking, I was thinking about data dissemination as a kind of remittance too, and like how can we keep pushing ourselves to make that more impactful to communities versus the tendency in community-based participatory research as sort of just a checkbox. Oh, well, they know what we found and now we're done. And I think we're in the COFs and in all these other projects that were presented, I think we're pushing that boundary in a good way. And I think we need to keep pushing it. I also was really struck by the diagram of principles of co-produced research, and I'll look forward to learning more about that, particularly the top part about information asymmetry and what that means, what the consequences of that are for communities that participate in research. And I also thought about the film. I recently went to the Watsonville Film Festival virtually, and there was a film called 5 Years North about Guatemaltecos living in New York City. So not farm workers, but what's the word we're developing? Food production workers, restaurant workers in New York City. And there was a scene where one Guatemalteco indigenous man had been in New York for over a decade and was able to build his family a house where all 8 or so children had their own bedroom. And it wasn't like it was this huge house, but I was struck, like, as you were talking, I think in the film, there was this tendency to make it look like this very grand thing, when in fact for them, it was like a very simple, practical matter of caring for the next generation of his children. And his nephew comes and he is stuck in this other limbo where he is being forced to go to school, and school, which is like how the United States defines wellness for minors, was not a good a wellness plan for this young person, because the stress and pressure to work to support his family, his ailing grandmother, his younger siblings, like literally made him sick. And so like, how do we also reflect on the tensions of how care is defined within institutions? I think would be good to challenge that in your work as well. With Lynn, Lynn is raising some important points about like how people actually identify versus the tendency of institutions and academia to lump everybody together for the sake of convenience or shorthand or saving word space in articles. But I think what a memory it triggered for me was in thinking about and in reflecting on the chat banter that happened at the Mesoamerican Languages Conference, was that this is also happening within the land back movement. And I saw a similar interchange where there's a campaign in Fresno to put yard signs that say, this is Yokuts land. But Yokuts is this sort of catch-all category of language that was imposed on indigenous peoples in California by anthropologists and others who were like running around in the Central Valley and the foothills trying to study people and write about indigenous people without their consent or input. And so indigenous folks said, no, we are Chukchansi, we are this, we're Wukchumni, we're all these other things, and Yokuts is something that's imposed upon us. So in addition to like the fact that there's other conversations happening about this within other communities, I think it also ties to efforts to be more upfront in our conversations and community spaces about how we identify your gender, your preferred pronouns, and like maybe perhaps working to normalize other kinds of identities when we come into those spaces could be part of that movement work too. Even though it takes longer, it reminds me of the practice of palabra, where you just have to let it all out and put it all on the table in order to move forward. I also though wonder if there's a challenge to dropping immigrant and migrant, because I know a lot of people have a lot of pride in those concepts too. And so how do we deal with those tensions and the mobilization of those terms for other important movement work like undocumented, undocumented, and so on and so forth, where you're leveraging that identity and the legal limits imposed on people of that identity to claim status. Tim, the work on gardens as a social, emotional, and health resource and care system is really important. And I think it's in the Fresno Freedom School, which is an organization I work with of Black gardeners and farmers, instilling those skills and knowledge into younger people in West Fresno. One of our board members says, we're having a moment. Gardening and home arts and all of that is having this revival amidst the pandemic, but these are things that people, indigenous people and African-American people and poor people have been doing for a long time, not just because of survival, but because this is just how you live with the land. And I wonder if gardens too can be a space for more of those transoccupational, transgenerational solidarities to strengthen their ability to provide for communities in the ways you've identified, but also in other ways as well. Your talk also made me think about the idea of climate grief and how different communities are coping with climate grief, and how Indigenous folks in particular are processing what's happening here because they may have experienced similar things, including climate-induced displacement from land via droughts and war conflict-based damage to their land or appropriation of their land. And so like how are I'm very curious how people are processing that and how these gardening spaces can be expanded to foster healing and inclusion and resistance to climate change and the collateral effect, the collateral damage, which is going to be shouldered mostly by the folks you're working with. Let's see. Valentine, your talk reminded me a lot about the idea of prescience or been known, is what my colleague Carolyn Collins at California Institute for Rural Studies calls it. You all have known about these problems for decades, and it's like just now certain institutions are waking up to the fact that they need to be more accountable and attentive to communities, even though y'all have been saying it for decades through Oregon Law Center and other community-based organizations. And I had a similar moment with a local Department of Health here in Fresno where you know, we were invited to be on this press conference, and early in the pandemic, I think the health officer here, maybe with good intentions, wanted to open up that online press conference space to kind of share different pandemic realities and have news journalists be focusing on those different angles. But it came at the time there were outbreaks at the poultry and meat processing plants, and you know, departments of public health were doing inspections at these places. And I think there was this tendency to just accept what industry was saying. Well, we can't slow the lines down. We can't space people out. We can't change the layouts of our plants or our orchards or whatever. But those are things that workers have been asking for decades, not because of COVID, but because of all the other hazards those infrastructures of labor and work pose. And so I'm curious about how do we who are in it cope with like the prescience of knowing what is like very clear and obvious, and despite repetitive efforts to instill it, the urgency in others who have power to change, do nothing or little to nothing. And how does that affect our own grief too? And how do we cope with that? But I also appreciate your enthusiasm around data as a tool in community-based organizations to keep pushing for those things that are so important. And that gave me hope to keep doing what I'm doing when I often feel very hopeless about it because it's so slow. And Lydia too, I'm really impressed that you and your colleagues were able to develop close and trusting relationships with H2A workers, and that the Food and Environmental Reporting Network was able to mobilize some of their findings to create very powerful data visualizations. And this is another example too of prescience, where a system that was designed to just extract labor from people is not very well prepared or at all prepared in the face of a disaster where none of those needs are met, and then those vulnerabilities just get transferred onto the individuals, and then they get blamed for exacerbating the pandemic. And so it's important that our work resists that cultural tendency in journalism, in policy spaces, in industrial discourses that deflect responsibility and accountability. Your work also reminds me of Michael Mendez and Mikop's piece on invisibilized victims of disaster, of how how this pattern of how institutions neglect of communities perpetuates their vulnerabilities and crises. And the fact that H-2A visas were the only ones to increase during the pandemic is also telling of what's to come. I also would worry about what H-2B workers who were allowed to stay were doing when they didn't have work, if the crabs or the shrimp or whatever were out of season, for example. Like that might be another question for future work in terms of, yes, they were allowed to stay, but what happened to them while they were here, even if they didn't have work, because it's seasonal work. One of your last questions was about how hard it can be, though, to do work with people who have no networks here. And I think there's some important models happening in Washington state with community to community and the Familias Unidas por Justicia, who are organizing with guest workers and have guest workers in their union membership. And so how can we use data collection and research as a way to organize people and get them connected to organizations, or to build organizations or found guest worker organizations or worker centers where they can have a place of community. I was thinking too about bracero communities, where braceros were also sent all over the country, mostly in the Southwest, and they found community through political organizing, realizing that they'd all been screwed by this bank account system, among other things. And so how can we learn from those lessons of the past, and then also the union organizing that's happening now, to support community building with guest workers, because I think it's going to be really needed, urgently needed, to prevent the very bad consequences that will result from the Family or Farm Worker Modernization Act and other things coming down the pipeline. I think that's all I have to say for now, but I want to congratulate all of you for doing really powerful and exciting work. And I don't know if folks in the audience have questions, but thank you for having me be a discussant. I really enjoyed it today, and I was ready to go at 7 in the morning. I'll just say that, Pacific time.
Yeah, thank you so much. It's been really great to be part of this roundtable discussion with all of you. Let me ask if there's any questions from the room. Yeah. Yes.
Hi, thank you all. I learned a great deal from everyone who presented today. I was in a session on Thursday where there was a brief comment about how cartel influence has extended all the way up into the U.S. and Northwest, and exerts control over a number of farm worker groups. If this is true, I'm curious as to whether you see this as an emerging problem. And if it's true, it would seem to greatly complicate and make even more precarious the situation of workers who are living even further into the shadows.
Were you all able to hear that? Oh.
I can start. I can't speak directly regarding the involvement of cartels in the workforce, but one thing I can mention is that as you all know, Oregon has legalized marijuana, and we have an increasing number of workers who are working doing cannabis work. One thing we have been seeing over the last couple of years is the increasing number of workers who are not getting paid. And because this is a new industry, I believe that we don't have an adequate system in place to be able to inspect, to be able to enforce laws, to be able to ensure that people who are working are getting paid. And we have found, many unpaid wages of anywhere between, a couple of people up to 100 people who are being asked to go and do trimming work, planting, and other types of cultivation activities. They go work for a week, perhaps a month, couple of months, and then the employer disappears. And so what is happening is that we have many growers who are just renting properties throughout the state. And we have landowners who are not getting contracts signed, making sure that those individuals are an established entity and are complying with the law. And so you have landowners who don't know, that they had a group of workers who were not being paid. And so we are seeing a lot of wage theft cases, and it's really hard to investigate and litigate those cases, because many times those who are in charge, they just disappear. There's no business established. They're not registered with the state. They're not, licensed to grow cannabis. And it makes it really difficult for the Oregon Law Center to, litigate those cases. And so that's an increasing issue that we've been seeing. And our Farmworker director has been doing a lot of advocacy work, ensuring that we create a better system and make changes in regulations and policies to ensure that the states can do their job when it comes to enforcing laws and making sure that farm workers are not being exploited.
Yeah, I'll just add a little bit to what Valentin said. I mean, it's not news that organized crime is involved in labor. The integrated business of smuggling, of guns, of cash, of drugs, that economy runs right into the US. It has for a very long time, right up I-5. And of course, it's integrated into communities, it's integrated into police departments here. And it's ultimately linked to US consumption of drugs. So that's, that frame has been around for a really long time. I think there's a lot of attention being paid to this in the past year by the press, sheriff's departments in Southern Oregon and other places are finding cartel-run grows where people are renting out their land. And the exploitation of workers continues. There are, for example, through networks I participate in, there are folks from Guatemala and other places who are actually selling their land, for $20,000 or $30,000. They're going into debt. They're coming, and some of them are ending up working in these grows under the conditions that Valentin just laid out. So it's it's getting more news in the press, but cartels were growing in national forests in Oregon, in California, in Washington before pot was legalized. Now there's a dual market. People continue to consume in Oregon and Washington pot from the black market. So I want to also just bring to the table the issue of the consumers. And that this, integrated business system has been around for a long time. So I'll just stop there, and I'm sure other people may have comments too.
Yeah, I have a quick comment just to expand this discussion a little bit. Yes, obviously, marijuana growing and Mexican cartels are part of the thing, but they're not the only organized crime, and it's not always about drugs also. The Oregon forests have a large mushroom industry, and some people say the mushroom industry may be more valuable than the forestry industry in Oregon. And there's a lot of organized crime from across the Pacific, specifically of harvesting matsutake mushrooms. There's Hmong communities, Vietnam communities, Mexican communities that get exploited to do these mixed mushroom picking for the exportation of the matsutake mushrooms to Japan and other really big import centers for those type of prized delicacies.
Just to add a brief note, and to talk again about hemp and marijuana, I think another piece is also because some of these are, illegal pot growing, jobs. So a lot of times what I've heard in my own networks is that folks are recruited, including from the Central Valley, up north of through California to Oregon. But then ICE comes and raids, or different organizations comes and raids, takes everyone. People don't get paid, like Valentin was mentioning, but also there's these other impacts due to immigration status. So I think immigration is also another key player here of keeping that vulnerability, and especially in this industry. Also, I think there's a still a cultural stigma, when folks are reporting whether they work for hemp or not, right? And so I think that is also something to keep in mind. And then just finally, I wanted to mention for whoever's in the room who asked that question, to check out UNETE. They're an advocacy organization in Southern Oregon. They've been tasked with responding to COVID, the wildfires, and also a lot of recent cases of trafficking of farm workers. So I would definitely I can leave the link in the chat, and then maybe Tim could share it with you. So UNETE, organization in Southern Oregon.
I wanted to add just that vulnerable systems that have these gray areas where there's not a lot of supervision, and where there's this, again, vulnerable systems that are not well organized, that are not very accountable. People cannot really look what they're doing. They're just a very, how would I say, an opportunity to all these criminal activities to increase their criminal networks. This happens a lot in the H2 program. I mean, not specifically with one cartel, but with many cartels, and not in a very specific, not in one specific way as of drug trafficking, but as a network of criminal activities, for example, that are to install fear on workers, to not denounce fraudulent hiring or other activities like that. So just it highlights the importance to look at these structural vulnerabilities in these labor systems, where these other criminal actors find it a nice place to develop their own activities.
Okay, we have about 5 more minutes. Is there another question?
Yes. Hi, everyone. Can you guys hear me okay? Yeah, I want to reiterate my congratulations and thanks for putting this amazing panel together. This was really great. I think my question is probably most for Valentin, but I'd certainly welcome everybody's inputs. I was so interested in what you were saying towards the end of your talk about the need for better data and identifying gaps in the data that's available on farm workers. This is speaking, it speaks to some of my ongoing work and interests in how the way that the USDA collects data, like the shape of its instruments, is part of what's upholding injustice by creating spaces that are seen and spaces that are unseen. But then I have conversations with myself and with colleagues about what is lost when we increase conduits for surveillance, and if there's benefits to being able to stay kind of flying under the radar that you give up if you're increasing the sorts of data you're collecting. So I would just love to hear your perspective on if that tension exists, and like how to address it, or what are ethical ways to increase the types of quantifiable data have access to and collect.
Did you get that, Valentin?
I missed the second part. Sorry, I have.
Sorry. I'm interested in and very much in agreement with you about the need for more data, but I've been trying to think through there's things that are also given up when you increase when there's more questions being asked and more people paying attention to vulnerable communities and being able to fly under the radar a little bit is maybe a benefit too. So just, I'd love to hear your perspective on if that tension exists and what the pros and cons are and how to do quantifiable, this type of, systematic drop-down menu, census type data ethically.
And then, yeah, she also mentioned the first time, kind of also just highlighting the tension of increasing data collection and not it being surveillance and kind of the tensions between that.
Right. So one thing that we have tried to do is to increase data that helps us understand what's happening so that we can do our jobs better. So I'm thinking about targeted outreach. We all can do outreach, right? But when it comes to limited capacity, limited resources, we really need to know our community so that we can target resources, so we can target geographical areas, mom communities here, Mixtecos here, let's develop a public service announcements, PSA in mom in this area, and let's do a Mixteco in this area. I'm also thinking about litigation data. Oftentimes, many of the cases get settled outside of court. Even after a lawsuit, it's filed in court. But having data about the types of workplace violations that we see, I think it's important when it comes to advocacy work. By seeing a trend of the various issues that will help you say focus on some of the most important work that we need to do some advocacy work. One thing that we don't collect, information that we intentionally do not collect, or we don't encourage the collection of data, it's when it comes to legal status. I think it does get really, really complicated. But one way to address the issue of surveillance, I think, is incorporating and engaging community members themselves in developing the questionnaire, the survey. I think that's one thing that we have done here with the COVES research study. I'm not a researcher, I'm just a community outreach worker, and I was invited to be a part of it. And I can lift out the voices of farm workers of what information they think our community needs to know about them to be able to serve them better. So I think engaging, people that have solid trust with the communities that we're trying to research, to be engaged in all of the phases of the research, I think it's really critical. I think that's one way of addressing the concern about surveillance.
I appreciate it.
Yeah, thank you, everybody. I think we're out of time, but it was so great being part of this discussion with you. I hope we could all meet in person. It's really remarkable that we've done all this work together, all remote over Zoom. We've only met once. Yeah, I can't wait to be with you again in person. And just thank you so much for everything. This was amazing. And then I'll be putting the resources you shared on the screen for.
Thank you, Tim.
Deborah and everybody.
Bye.
Thank you. Goodbye.
I'm just now getting into